and good evening to one and all. I, Dr. Savri Savan, on behalf of Voice of Healthcare, welcome you all to the National Forum on World Liver Day, expert conversations on liver health, organized by Voice of Healthcare and supported by Manipal Hospitals. For this live panel discussion, we would be discussing all about liver health. Our topic for today's discussion is Healthy Liver, Healthy Future, Novel Treatments in Liver Cirrhosis, and Pledge for Healthy Liver, Latest Interventions in Hepatitis Treatment. To discuss this topic in great detail, all for the purpose of public health awareness, we have leading experts from Manipal Hospitals here with us today. Please allow me to welcome Dr. Raghavendra N., who is the surgical gastroenterologist at Manipal Hospital, Heppal. Welcome, sir. I welcome Dr. Anup Alwa, who is the gastroenterologist at Manipal Hospital, Mysore. Welcome, sir. I next welcome Dr. Nikhil Shelagi, who is the surgical gastroenterologist for Manipal Hospital, Whitefield. Welcome,
Hello.
sir. I welcome Dr. Raj Venugopal, who is the gastroenterologist for Manipal Hospital at Old Airport Road. Welcome, sir. I next welcome Dr. Vidya Sagar Ramappa, who is the gastroenterologist at Manipal Hospital, Yashwantpur. Welcome, sir. So, without wasting any more time, let us start with our session for today. So, round one, we would be focusing on the novel treatments in liver cirrhosis. My first question would be to Dr. Raj. Sir, is liver cirrhosis reversible? Because how we believe is liver diseases are related to mostly to lifestyle if they are not hepatitis, is what people presume. And we wanted to know what role does lifestyle modifications play in the development of liver diseases. Can you please talk about if it is reversible and the cirrhosis diet, that is what kind of lifestyle is recommended to prevent cirrhosis? Over to you, sir. Dr. Raj, sir, you are on mute, so we cannot hear you. Yes,
Yeah,
please go ahead.
this is a very common question asked by the patients whether the cirrhosis is reversible or not. So the conventional thinking was that the cirrhosis is an irreversible process, and once you have an established cirrhosis, you cannot get the liver back to the normal stage. Liver disease doesn't happen over a short period of time. It is a result of insult or to the liver over a long period of time. So the liver goes through a lot of changes from the stages of initial inflammation of the liver, which goes through a process of fibrosis, which goes from stage 1 fibrosis to stage 2, stage 3, and then finally it results in cirrhosis of liver. So the recent studies have shown that if you treat the underlying cause for liver disease, like say instance hepatitis B infection, hepatitis C infection, the new modalities of treatment have come for these infections. And once you treat this infection, you have found that in many cases this fibrosis and even late fibrosis can get reversed to a normal stage. But once you have an established cirrhosis, that is when your fibrosis is more than stage 4 fibrosis, and when there is synthetic dysfunction, that is functioning of the liver is affected, in such a scenario, it's very unlikely that the liver would come back to the normal stage. So there's a lot of research going on in this field on various medicines which can have an impact or which can help in reversing the fibrosis. But unfortunately, none of them has been come to the patient's experience. So we'll have to wait further for these medicines to be available for us to use in patient care. Coming to the lifestyle modifications which you need, we well know that that's an important part, and changing the lifestyle can halt the progression of cirrhosis. So few things which have to be highlighted here is one is the consumption of alcohol. Even in a normal person, consumption of alcohol beyond a particular limit can affect the liver. So it is generally considered that in a patient up to 6 drinks per week would be a safe drinking limit, and anything beyond that might damage the liver. So if a patient already has an established liver disease or cirrhosis, there's an absolute drinking alcohol is an absolute no. So similarly, smoking also has a bad impact on the liver, and cessation of smoking would also help in reducing the progression of the liver disease. Health, apart from these two things, healthy living lifestyle, like having an active lifestyle of exercise and consumption of healthy food, also goes a long way in limiting the progression of liver disease. One of the other common problems what we encounter is the unscrupulous use of allopathic, Ayurvedic, homeopathic medicines by the patients themselves. Patients who have liver disease should limit the use of any other medications, because so-called safe medicines can be toxic to the liver. We have had many instances where the over-counter use of all those medicines, even allopathy, Ayurvedic, homeopathic, has resulted in more serious damages to the liver. So self-prescription is an absolute no in patients who have liver disease. And even when they meet any doctor for any other disease, they have to tell them about this underlying liver problem, so that the doctor would be very cautious in prescribing medicines to them. Few other points to be noted here are patients are prone for infections. Is patients with liver disease have a very low immunity, and they can pick up infections. So they have to avoid picking up those infections. For instance, eating from outside and roadside vendors, especially all those pani puri, those kind of stuffs, can be a lethal cause for infection of hepatitis A, hepatitis E, which on a diseased liver can cause more damage. So they have to be very choosy about eating, from where to eat and what to eat, and probably very hygienic eating habits are very essential in patients with liver disease. Apart from this, there are some vaccines which are available for controlling various super infections in patients with liver disease, like flu vaccines, pneumococcal vaccines, hepatitis A vaccine, hepatitis B vaccine. So they have to periodically check with the doctor and take those precautions to avoid further injury to the liver. So I think I've summarized most of the points which you've asked me.
Very rightly explained, sir, that precaution and taking care of what you eat and what you put in your body is definitely very important. Although my next question is related to hepatitis, but I'm really tempted to ask you this right now itself. So, going on in the same chain, what kind of methods of diagnosis do you feel are available for hepatitis treatment in India for detecting hepatitis? And do you feel if they are any different from the ones that are available in the developed countries?
So we have, basically 5 viruses which are known to cause damage or disease to the liver. These are hepatitis A infection, hepatitis B, hepatitis D, hepatitis E, and hepatitis C. So these are the five viruses which normally you encounter. In these 2 viruses, hepatitis A and E are waterborne infections. They do infect patients by when they have consumed contaminated water or contaminated food. And these infections can be easily diagnosed by a simple blood test. So these tests are very easily available, and even some of the smallest labs or any small district hospitals might have the facility to do these tests. You don't need high-end tests to diagnose these infections. Other infections like hepatitis B, C, and hepatitis D, they all cause through certain procedures, blood products, when you use some unsterilized equipments to do the procedure. So these are the causes mainly for transmission of these viruses. These viruses again are diagnosed through simple blood test. So all those tests are available in our country, and you don't need any sophisticated equipments or diagnostic methods to diagnose these infections. So all patients who undergo health checkups or who have not tested for these viruses should look for this viral infection with these viruses. And if they are negative, 2 of the viruses have vaccination available for prevention, so they should be taking these vaccines.
Thank you so much, sir. Going on along the same chain of hepatitis, my next question to Dr. Anoop is, please, sir, can you explain in brief about the different kinds of hepatitis diseases that are, that are most prominent that you see in your practice, and what are the causes and the presenting signs of each of these?
Hello. That's a
Yes,
very
sir. Yeah.
pertinent question. Basically, causes of hepatitis are many, but I'll just focus on the common ones that we come across. In India, I suppose the commonest one is alcohol, and excessive consumption of alcohol can lead to inflammation. We call it alcoholic hepatitis. And if the insult were to continue, it leads on to liver cirrhosis. However, I suspect that with the coming years, diabetes and metabolic diseases, that is obesity, lipid disorders, and of course, uncontrolled diabetes would be the major cause for inflammation of the liver, leading to hepatitis, also called as non-alcoholic related causes of hepatitis. The third, obviously, common ones in a tropical country such as India would be viruses. As Dr. Raj already mentioned, the common viruses that we see are hepatitis A and E, that are directly linked to sanitation and hygiene. So consumption of dirt, unclean water and food leads to propagation of this, and this can reach epidemic proportions because they can be easily transmissible and can involve large proportions of the population. The other two viruses, hepatitis B and C, are usually are transmitted through blood disorders. To an extent, I think we are successful in kind of increasing awareness and decreasing the propagation of these two viruses. Then, of course, there are other uncommon viruses like Coxsackie, hepatitis D, and other Epstein-Barr viruses that we see once in a way in our practice, but not of cross significance. The third important cause would be drugs, of course. Even Dr. Raj touched upon that. Most of them are overdosing or wrong dosage of allopathic drugs, but we see considerable amount of herbal medications as well, leading to hepatitis. So it's always part of our history taking. We make sure that we get a complete list of medications that the patient takes. And herbal medicines are found to be one of a predominant cause for drug-induced hepatitis. And it is not just in villages. I think even in cities also, it is kind of an upward trend, particularly when diseases like dengue leading to low platelet count, now the new COVID viruses. So people have a tendency to go and experiment with certain of these drugs that promise miraculous cures, and they end up with hepatitis, inflammation of the liver, and come to the hospital. The others are rarer disorders. Most of them are inborn errors of metabolism. There are disorders causing hepatitis like autoimmune diseases, which are usually picked up on a careful history and certain lab tests. But what I would like to emphasize on are certain things that we can prevent. The preventable ones are the top four, which is avoidance of alcohol. We can prevent alcohol disease. Improving lifestyle, control of blood sugars, maintaining a healthy weight. We can prevent the next epidemic that is coming, which is non-alcohol related hepatitis. The third one, of course, is viruses. Improving hygiene, safety practices, being very careful of the cleanliness of the water and the food, and safe practices helps in decreasing this kind of viruses. And finally, the fourth one, which is appropriate medications at appropriate dosages, and only with the very strict prescription, this will cut down on the drug-induced hepatitis.
Thank you so much, sir, for so simply explaining all these things for our audience. My next question would be to Dr. Ramappa. Sir, can you please compare and contrast between liver cirrhosis and hepatitis disease? Can you please explain to our audience what are the main differences in the presenting signs and symptoms of these diseases that our audience should be aware of? And what are the existing methods of treatment that are available? And do these treatments that are available in India, if they vary from the developed countries in any sense? Over to you, Dr. Ramappa.
All right. Thank you for asking me this question. See, it's a continuum. Inflammation of the liver is called as hepatitis. And continued inflammation of the liver will lead to injury. Injury heals up by means of scar tissue replacement. And when once the liver is completely burdened with a lot of scar tissue, where more than 2/3 of the liver is replaced by scar tissue, that condition is called as cirrhosis. And anything lesser than that is called as significant fibrosis. So there is no tight watershed compartments. So sometimes both can exist together, where there's inflammation as well as scarring. So many a times in clinical practices, someone who has an inflammation that comes on very suddenly, they can manifest with certain signs and symptoms which are pretty non-specific, like flu-like symptoms, no appetite, nausea or vomiting sensation. Sometimes they may have a small amount of a fever. But many a times we see chronic or long-standing low-grade inflammation which may not manifest any symptoms. So it's a very silent kind of a disease or a killer disease. Occasionally, people may come to know about this inflammation process when they go for some regular health screen and health checks, and they find that the liver tests are slightly abnormal. And when they consult their specialists or the doctors, they come to know about the inflammation in the liver. On the other hand, on the extreme spectrum, you have this condition called as cirrhosis, which Dr. Raj has alluded to, which is significant scarring of the liver, and the whole, or at least 2/3 or more than 2/3 of the liver is replaced by scar tissue. And this is when the liver becomes dysfunctional in its functions and properties, which can manifest as, early signs may be just people may start losing weight, unexplained loss of muscle. In more advanced stages, people may start to accumulate water, like water retention, like swelling of the legs, or they may come with increased distension of the abdomen because of fluid filling up in the abdomen. Occasionally, we also see people coming with vomiting of blood, because when the liver becomes scarred, it becomes stiff. The inflow of blood into the liver is under immense pressure. So the blood which is flowing inside the liver gets diverted to nearby organs, such as the stomach and the food pipe. And these are small caliber blood vessels, and they cannot hold the high pressure blood. And therefore, these vessels do rupture and may cause vomiting of blood or passage of digested blood, which is called as melena in medical terminology, where the people may come in with black stools, not feeling great, with low blood pressure. And very rarely people may come with, a completely failed liver with jaundice, and sometimes they may be very drowsy. The day-to-day living activities of daily living may be impaired by mental slowness and physical slowness. So these are the variety of symptoms that how it may manifest. So in summary, it can be a complete silent killer without producing any symptoms, or on the other spectrum, it can produce a full-blown array of symptoms from jaundice to leg swelling, fluid accumulation, vomiting of blood, and even a person can come with very obtunded mentation. So that's how they can present with. And coming to the question of how they are similar or different, it's a continuum. There are no watertight compartments. And what was the other question? Sorry if I...
So it was, what kind of impact does lifestyle have on hepatitis? What level of impact does that have?
Certainly, yeah. As both Dr. Raj and Dr. Anup Alva alluded to, most of these are preventable disorders or diseases, like inflammation of the liver. The most common scourge of the modern day society is, we are an obesogenic society. We are eating bigger portions. We are consuming more amount of carbohydrates, sweets, and other things. Increased consumption of alcohol. And we are forgetting, because in a busy modern day life, we fail to give importance to our basic day-to-day healthy practices, making good choices in terms of our diet, as well as forgetting about our exercise and healthy lifestyle. So that's most important. The need of the hour is eating the right kind of stuff, curtailing the alcohol or making zero alcohol if possible at all, and drinking responsibly in people who do consume alcohol, and looking after your body by giving regular exercise and maintaining your body weight in the healthy range.
Thank you so much, sir, for so simply explaining all these things to us. So, as when I was listening to you right now, I had this curious question that I have heard people say that soda is just as bad as alcohol. What would be your take on this one? What do you believe?
See, alcohol, we certainly know, even a common man knows that alcohol does cause problems. But what the common man or the society knows is that alcohol, when consumed in large or excessive quantities, can cause harm to the liver. But alcohol is just not only liver and liver problems, but it can cause a protein manifestations. It can affect your nerves, your brain, your heart, your muscle, your digestive tract, and including the liver. One of the most important messages that what I want to give is, yeah, alcohol has a protein manifestation and multi organs can get affected, and liver is one of the softest targets. So drinking responsibly or having no alcohol is the best way forward. And people say yes, they compare it with soda. Yes, scientifically speaking, what is soda? Soda is nothing but carbon dioxide mixed in water. It's basically an acidic solution. Yeah, it gives them a little bit of pep and people can able to belch easily. Does soda cause any harm to the liver? No. Yes, because it's a weak acid, it can cause certain digestive disorders like acidity, belching, burping, but more so, it shouldn't cause much of a liver issue. Having said that, soda is not consumed alone. It is consumed with sweetened flavors like Coca-Cola, or not to mention any of these brands like carbonated or aerated drinks, which do contain a lot of sugar, artificial sweeteners, and then yes, these hidden sugars do affect the liver in a bad way, and that forms what forms the basis of the non-alcoholic fatty liver disease, which Dr. Anup mentioned. And there's a huge problem, especially in the Middle East and in the Western countries like America, Canada, where there's a high consumption of soda. And when we call it soda, it's these carbonated and sweetened beverages, which is a huge carbohydrate or a sugar load on the liver to deal with, which is an important cause for non-alcoholic fatty liver disease.
Thank you so much, sir, for giving me answers to my curious questions just as they came up. Moving on, my next question is to Dr. Raghavendra. Sir, what is the treatment protocol that you follow for hepatitis in India? And what are the existing methods of treatment? And do these vary from those available in the more developed countries?
So probably, thanks. I would probably answer it from backwards. There is no different methods or techniques available in the developed countries. We use exactly the same methods. The treatment protocols depend on whether the liver disease is or the cirrhosis is decompensated or compensated. In people with decompensated liver disease, one who have noticeable jaundice or abdominal distension or bleeding manifestation, one who frequently get admitted with infections or recurrent drowsiness or kidney problems. These patients require transplant at a much early stage because they are already decompensated, and without the transplant their survival, say for example even 3 or 6 months survival, is very difficult. I would say it would be less than 30-40%. So unfortunately we don't have any medical treatment to cure the liver cirrhosis. Medical treatments are of course available to treat the complications of liver cirrhosis. One who presents with abdominal distension, we can give medicines so that he can pass more urine, the distension gets reduced. Or one who presents with bleeding and they undergo endoscopic procedures or intervention procedures like TIPS to reduce the chances of bleeding. And kidney dysfunctions, they have various medicines to treat. So in the sense, if they are decompensated, they go in for transplant. If they are not decompensated, if their severity scores are lesser, probably they can be managed, although palliatively, with the medicines.
Thank you so much, sir, for explaining that to me and to the audience. My next question is to Dr. Nikhil. So, sir, what kind of support, in your experience, do clinicians require right now from the government in supporting them for better hepatitis, care? and what sort of support you require from government, from health organizations for adopting and implementing more affordable and effective early detection and care for hepatitis.
Thank you, Dr.
Over to
Aswari.
you, sir. Yeah.
Yeah. So I'd like to tell you this viral hepatitis is a global public health problem which is more common in developing countries and resource poor countries. The prevalence of population prevalence of chronic hepatitis B in India is about 5%, and there is geographical variation. There is high prevalence in states like Arunachal Pradesh and Andaman. So first step is to actually reduce the burden of the disease. So by reducing the burden, we will have less infective cases, further less transmission, and hence we can come down on the numbers. So the first of all, I think the starting with awareness among the general population, where we can create awareness regarding the modes of transmission of chronic this hepatitis B infection, hepatitis C infection, so that we can cut down this transmission. Apart from this, where we can educate people about consequence of consuming excessive alcohol and its consequences on liver, and then where we should have a strict screening protocol, before allowing someone to donate blood for screening for all the viral and infections, and then again same protocol before transfusion. So this would in fact help to reduce the numbers. Apart from this, there should be mandatory vaccination against hepatitis B infection among all the population. And coming to next thing is the one of the commonest mode of spread is usage of inadequately sterilized needles and syringes, which has caused outbreak of hepatitis B infection in majority of the cases. So by decreasing this, we would actually reduce the number of cases. Apart from this, we should screen the general population in high prevalent areas, so that where we can diagnose make a early diagnosis, hence we can keep them on surveillance treatment accordingly. Then apart from this, we should have established dedicated centers for management of the cirrhosis and surveillance of the treatment, and to keep a central database. This is basically from the National Center for Disease Control under DGHS. I think they can have a central database where all the patients who have been diagnosed with either hepatitis B or cirrhosis, or already have got cirrhosis. So where they can have a data and can actually monitor the disease progression. Apart from this, where we can have is easy accessibility to the dedicated centers, where I think these people can get their tests done on a regular basis and get medications at an affordable price, so that they are very compliant to the treatment. I think these are the main things I think which would help the patients with chronic hepatitis B, hepatitis C, or the other causes of cirrhosis to stick to the treatment, and then more compliant to the treatment, and hence the disease can be kept under control.
Thank you so much, sir, for explaining it to us. Moving on to liver cirrhosis. My question is to Dr. Anup. Sir, can you please explain the audience in simpler words what all different types of liver cirrhosis are there, and what are the signs and symptoms of these different types? What should people be aware of when they look of any abnormality that they need to see a specialist doctor and get their liver checked? And I have also read, and as we know, that liver diseases often have no signs or symptoms until the liver damage is very extensive. Why would that be? Can you explain it to our audience?
I'll start with your second question, because then we can set the tone. You have to understand that liver is a very versatile organ. It performs plenty of physiological functions, and it has an immense ability to compensate. So that's the reason why in the initial stages of to an extent, it can compensate, it can handle its insults. However, if the duration and if the extent of insult overcomes the liver reserve, its signs and symptoms start manifesting. Now, the reason for answering this first is it's pertinent that everybody realizes that there are two types of beaches in India, for an example. One in which you can keep walking into the sea and the water level keeps rising proportionally and you know the depth of the place. And the other beach where you walk into a continental shelf, which means the water can be around your knees or your waist, and the next step you take, you're going to fall deep in. So cirrhosis is something like the second beach. So the tendency of people to assume that we can look at signs and symptoms and we can identify the extent of liver damage is erroneous. So the message here would be that signs and symptoms of cirrhosis manifest sometimes at very late stages. So the aim would be to prevent liver inflammation itself. As all the experts in the panel have already mentioned, it is a continuum. It doesn't start off and stop at any particular place. It's an ongoing process. And the aim of every person as a layman or a patient or even the doctor is to identify at the earliest stage and prevent progression of this insult rather than wait for a particular time and then start taking action. The aim would be to stop this at the first stage of inflammation itself. So if you can change your lifestyle, if you can avoid substances that can damage the liver, which is ideally a zero alcohol policy. Most of them commonly ask what is a safe limit of alcohol. Frankly speaking, there is no solid evidence for a safe limit of alcohol whatsoever. There have been studies that show dose and effect of alcohol, but you cannot extrapolate it and say that so much of alcohol is safe. So the first most important advice is no alcohol would be the best policy. This is one. Number two is, of course, the second thing that we can say is look at your diabetes and look at your other metabolic disorders early on, because non-alcoholic liver diseases that I was speaking about is just a hepatic manifestation of a systemic disorder. Just like every other organ can get damaged, liver can get damaged too. So taking care of the basics, which means taking care of your sugar levels, taking care of your cholesterol, changing your diet, having regular exercise, keeping your weight in check, this not only improves your overall health, which includes your heart, liver, and kidney, it takes care of your non-alcoholic liver disease per se. So the point of signs and symptoms of cirrhosis, from the patient point of view, the aim ideally to all those listeners today would be to identify this as early as possible, or rather to prevent it in the first place by avoiding harmful substances, for taking overall care of your health, and for practicing hygiene and safe practices. This would be your first step. The second step would be to take regular care of your health, which means if you're one of those high risk groups, make sure that you keep your diabetes, you go for regular health checkups, and some of these damage changes or insults can be identified very early. Let us say a patient with diabetes goes for a regular cardiac checkup and a health checkup, a liver function test were to be done, and we find certain changes in your serum transaminases in your liver function. You can immediately pick up certain changes there and then, and we start reversing the process right from there. What are the other signs and symptoms out of curiosity? It could be very non-specific. It could be something like nausea and vomiting. It could be loss of appetite. It could be loss of general feeling of strength, fatigue. And there are certain things that can be easily identified, which is yellowish discoloration of the eyes. Very common. Most people pick it up. Jaundice. Either the patient himself when he looks into a mirror, or some relatives can pick it up, people around. It can be changes in your skin tone or color, rashes. It could be swelling of your abdomen and feet. It could be slight changes in personality. Even that can be picked up early, or when the doctor asks for a history. It could be changes in your sleep patterns. People who don't get sleep properly at night tend to be extremely drowsy in the morning. These are certain symptoms that a patient can or relatives can identify. What is a doctor looking for? A doctor is looking for a detailed history in which he asks for all these symptoms. He asks for the habits of the patient, personal history of the patient, other risk factors, and looks for particular signs in the body, which could be, once again, yellowish discoloration of the eyes, skin, changes in the skin and the nails. He can find out any problems in accumulation of water or fluid in the abdomen or in the feet. And of course, when he palpates, when he examines you, he can find an enlarged organs like the liver or the spleen enlargement. And there are other non-invasive and invasive tests whereby we can identify cirrhosis. So the take-home message would be, number one, make sure that your lifestyle or your habits do not lead to the onset of inflammation itself, number one. Number two, do not be in the misconception that it is like a disease that has clear, as Dr. Vidyasagar rightly said, watertight compartments, and it can be a continuum, and it's impossible to predict where you are in. So it's better to take remedial action as early as possible rather than waiting for certain signs and symptoms to pop up before taking your basic remedial actions like going to a doctor or changing your lifestyle. The earlier we identify and reverse, the better.
Thank you so much, sir, for so simply explaining everything to our audience and to me. So, on to you only, I would want to know for basic knowledge, how does the progression of this disease, how does a normal liver turns, then fatty, and, what are the different stages all towards liver carcinoma? What are the stages that we can see, and how does that progression happen?
Okay. I would reiterate what Dr. Vidyasagar mentioned. He explained very nicely. I'll just once again, I'll just summarize it. The first step is obviously inflammation. As the word suggests, there is changes in the tissue. So the first thing that happens is any kind of inflammation that happens in the liver, which can present with mild symptoms. As I said, once again, nausea, vomiting, or some pain abdomen. This progresses on as the insult worsens. It leads on to scarring of the tissue. Healthy tissue turns into fibrous tissue. Fibrosis is nothing but a reaction of the body to any kind of insult. And when this fibrosis, if it were to keep on worsening, like Dr. Raj initially mentioned, until a point it can be reversible. But if this insult were to continue, it goes on to form cirrhosis. Now, if you carefully observe, all these terms that I am telling you are histological terms, something that can be picked up in a liver biopsy, that is looking under the microscope: inflammation, fibrosis, and cirrhosis. And after that, they start having clinical manifestations and what we call end-stage liver disease, which means in chronic liver, in cirrhosis, you have a compensatory part where the liver is trying its utmost to kind of overcome the insults. And then when it is unable to do so, you end in the end-stage liver disease, which means the liver no longer functions to its best of its ability, and signs and symptoms they become absolutely obvious, both to the patient and people around. And the final stage, of course, of if the insult were to continue as part of this damage itself, is hepatocellular carcinoma or liver cancer, because you know that neoplasm usually tends to affect scarred tissue. So when the liver is no longer healthy and significant damage has happened, regeneration starts. It tries to attempt regeneration, and sometimes this regeneration can go out of hand and lead to liver neoplasms or liver cancer. So the stages would be inflammation, scarring, chronic liver disease, decompensation of the chronic liver disease, and liver cancer.
Thank you so much, sir. Moving on to Dr. Vidyasagar next. Sir, when it comes to the detection method for liver cirrhosis, can you please explain us the efficacy and success of the different methods of detection for liver cirrhosis? And does that happen that liver cirrhosis can be missed by detection methods sometimes, such as through CT scans or ultrasound or MRI? Can that happen? Over to you, sir.
Okay. Alluding to what I said earlier, the damage or the insults to the liver is a continuing spectrum. And on the right extreme spectrum, we see what is called as cirrhosis, or what Anup alluded to is end-stage liver disease. A cirrhotic liver means a scarred and a stiff liver. So generally, by whatever the tools we have to diagnose, we are looking at a scarred liver. We have ultrasound, which is a cheap, a very reproducible, and a very good tool which we can use in our day-to-day practice. It is very good enough to pick up a cirrhotic liver. On the other hand, we have a little more sophisticated, a little more expensive, time-consuming, and again reproducible, but may not be used in a sort of a screening method, what is called as an MRI scan, a different modality called as MR elastography, or even a CT scan. All of these compared together are comparable in detecting cirrhosis of the liver. However, in very early stages, when it's in a subclinical phase, where someone has a little bit of a scarred liver, but they're not manifesting any symptoms at all, and outwardly they look completely normal and functioning normally, sometimes a fatty liver, even though it contains cirrhosis at the molecular, at the very nitty-gritty level, the ultrasound may miss it. But having said that, ultrasound is a cheap tool. It's a very reproducible tool. It is an acceptable one, and it can be repeated again and again. And that's on one hand of the performance characteristic of these different kind of scans. And on the other hand, it is also the end user, like the person who scans it. If it's an expert, he can pick up some of the subtle signs that he or she may pick up in an ultrasound scan and may raise or flag up the possibility of an early cirrhosis even in an ultrasound. So my message would be there are good tools. Ultrasound, you have a CT scan, and you have an MRI. Comparably, yes, they do perform very well when compared to each other. However, in the very early stages, sometimes ultrasound may miss a cirrhotic and may wrongly or inappropriately label them as maybe a little bit of scarring or fatty liver when there's actually cirrhotic process that's going on. However, everything has to be put into the clinical context as well. What is the clinician suspecting? And is there a high degree of suspicion based on the other lab parameters or the clinical manifestation? So everything are not just black and white. It has to be interpreted in the clinical context.
Definitely, sir. Very rightly pointed out, because sometimes normal public has this misconception that if this disease is missed by one of the tests, that it won't get detected. But they fail to put this into picture, that the doctor consulting them is considering not just tests but his own clinical experience as well as lab tests and scans, and then giving them a comprehensive diagnosis and prognosis for their disease. So definitely, thank you so much for pointing that out. My next question would be to Dr. Raghavendra. So what are the protocols for the treatment of liver that you follow in your practice? And what are the existing methods of treatments that are available? Could you please explain it for our audience for liver cirrhosis?
I think for the cirrhosis, I've told already. If it is decompensated, they have to go in for transplant. If they are not decompensated, we can palliate their symptoms by various medicines. Depends on what manifestation do they have.
So then could you please clear the different treatment methods between cirrhosis and hepatitis that are available, so that we are more clear on that?
Treatment for the hepatitis depends on the type of hepatitis. Dr. Anup and Dr. Raj have already enlisted the various causes for hepatitis, particularly in India, if it's alcohol or viral or fatty liver disease related or sometimes drug induced, or at times various other metabolic causes or autoimmune diseases or copper metabolism problem, iron metabolism problem. The treatment for these hepatitis depends individually on what is the cause of hepatitis and are they presenting either in acute stage or in the chronic stage, and the liver function test abnormality that they have produced. So if we can identify a cause, particularly the viral cause, recently newer drugs have come which are tablets taken once a day and are short term, particularly hepatitis C. Earlier, it used to be a very costly affair, the treatment injections for 6 months. Now it's hardly 3 to 4 months. Single day tablet should suffice their treatment. And if it is for copper or iron metabolism, we have various tablets, but usually they present at the end stage liver disease where they would require the transplant. Detecting them early on is much more difficult. So if you are looking at hepatitis, either alcoholic hepatitis, stop the alcohol and give the supportive medication. If they are viral hepatitis, give the antiviral drugs that are excellent, and the current generation ones are good enough to treat their hepatitis.
Thank you so much for summarizing that, sir. Moving on, my next question along the same lines is to Dr. Nikhil. So as Dr. Raghavendra said that there are some new medications that are available that are much more effective. Could you please share any of the novel treatments that are available for liver cirrhosis now that can help in reducing the burden of this disease?
Yeah, I think as everyone has discussed now that it's an hepatic dysfunction with severe scarring. So it's the irreversible damage has already occurred. So the only treatment, curative treatment, is always the liver transplant. And there are a lot of patients who are waiting for liver transplant during the course, where we can use all this novel treatment therapy so that we can halt the disease at that point, so that they get transplant free survival for some time, and they can slightly improve with quality of life and reduce the complications. So coming to this novel treatment, we have to basically target specific sequence in the pathophysiology where it would actually halt the disease progression. But here, since the disease is already irreversible, so the medicines, all the latest medicines are going to have only temporarily effect to prevent the further progression of the complications. Unlike in what we see in inflammatory bowel disease, where the disease whole thing can be modified with this novel therapy and avoid surgery. But here, the main complications what the cirrhotic patients have is massive GI bleed. That is, they can have blood vomiting or can have large bouts of blood in the stools. And after that, they can have too much of water getting collected in their abdomen. Apart from that, getting abdominal infection, that is called spontaneous bacterial peritonitis. Then apart from this, they can develop renal dysfunction, that's called hepatorenal syndrome. So we need to target each one of the complications in different patients. In a patient, someone who has got a lot of fluid accumulation, who is not responding to the medical management, who's been refractory to multiple drugs, what he's taking for fluid reduction, in them where they have to go to hospital once in a week or once in 2 weeks to get water removed. So in them there is something called TIPS procedure. This is a procedure where they insert a stent one from via one of the main vein, and it goes into the bigger vein in the liver. So this would actually reduce ascites formation. It would bring down the portal hypertension, and in fact, few people improve in the regarding the clinical course of the disease, and they remain stable with this. Apart from this, other complications like getting repeated infections in the water in the tummy. So there are medications which would target specifically where the organisms from the intestine get being translocated into the abdomen. So that can be prevented by few medications which are already being used, and they're quite effective. One of them is rifaximin. Apart from these are other complications like patients go into recurrent altered sensorium and drowsiness. This is called hepatic encephalopathy. In these patients, we would actually do something where reduce the gut load of the bacteria, where we would give rifaximin. And apart from this, there is something called LOLA and the branch chain amino acids. And then there are other novel therapy for these kind of patients is we do a CT scan and see if there are any major shunts where the blood is getting diverted directly away from the liver and into the systemic circulation. So here in this patient, sometimes we can embolize those shunts. That embolization is something where we block the shunts. So this would prevent further shunting away and reduces altered sensorium or drowsiness. And apart from this, these are the standard treatment which are already being used and have been proven effective. There are other few medicines or other therapies which have been used in a small clinical trial, which have shown some benefit, but there is no strong data to support that. One of which is GCSF, that is called granulocyte colony stimulating factor. Again, these are specifically has to be used in someone who is having acute alcoholic hepatitis, not responding to other medications. So there has been some benefit with these medications in the small trial which have been shown. Apart from this, we have something else where they use erythropoietin or combination of other medications. There are a few ongoing trials which are still being under study, where they've used statins in a patient with decompensated cirrhosis, and they have found that there is a prevention of progression of disease. Basically, the statins, what they have said is it would have the immunomodulation effect and improve the angiogenesis and causes tissue remodeling. Apart from this, there have been studies done in Denmark, Europe, where they've used albumin infusion on a regular basis once in 10 days or 12 days for a period of 1 year. And they've found out that the patients had slightly better improvement in the general condition and reduced transplant-free survival. So these are a few things which have been being tried, but there is still data to say that this can be used in practice. Apart from this, there is something called extracorporeal assist devices, something like where we have kidney dialysis. There's something for liver dialysis as well. Though this is not where we cannot use for in all patients. This is someone who is having acute liver failure, where there is bridging time required before we go in for liver transplant. So where this can be used to remove the toxic products from the liver. So these are few things which are the novel agents which are being used and which are under trial. So hopefully, if all this comes into practice, there will be a much better bottle. The different medications can be used and halt the process of cirrhosis.
Thank you so much, sir, for sharing that. It was definitely exciting to hear you talk about all such novel treatments that hopefully would soon be available. And I feel that all these treatments and all the information and all the great speciality that we have in our, in our country, the most important thing still lies is awareness. Awareness from the very grassroots level all to the top about your health, your liver, and how to take care and how to maintain good health. So, my last question to all our esteemed panelists today is, following this year's World Liver Day theme, which is to love your liver and live longer, what would be your one recommendation to keep liver healthy to all the viewers that is watching? So let me start with Dr. Nikhil, as we just had him.
Yeah, I think I would say with the current conditions and scenario in India, I think sedentary lifestyle. So I would say exercise, and apart from this, avoiding junk foods and having a high fiber diet, and then one who is diabetic to have strict glycemic control and to avoid excessive consumption of alcohol.
So the same question to you, Dr. Vidyasagar. What would be your one recommendation to keep liver healthy to all the viewers that are watching?
Okay, prevention is better than cure. So therefore, prevent the onset of liver disease or prevent liver diseases. So make healthy choices in your life, lead a healthy lifestyle. So that encompasses everything: what you eat, what you practice. So it's basically exercise, what was alluded to you earlier on. So mindful eating, keep a good body weight, exercise regularly, and eat the right kind of food, and practice a zero alcohol policy if at all possible. Or if you do have to consume alcohol, consume it very responsibly. That's about it.
Thank you so much, sir. Very rightly said. Dr. Anu, your turn now. Would you like to add on to it or support it, or please?
I just take this opportunity to dispel a myth. Most of my patients feel that the regenerative ability of the liver is inexhaustible, is infinite. They almost compare it with a lizard's tail. So most of my patients, when I say that it has reached end stage liver disease, they're taken aback. They keep asking me, but won't the liver grow back again? So I would re-emphasize that there is an extent to which the liver can take insults. So it's time to change your lifestyle, your habits, rather than putting all the onus on the ability of the liver to regenerate. The first attempt should be to stop insulting the liver, and the liver will take care of itself.
Thank you so much, sir. On to you, Dr. Raghavendra. Sir, what would be your one recommendation to keeping liver healthy to all the viewers that are watching?
I completely support whatever has been said before this. But the most important thing is, once someone becomes cirrhotic, it's very imperative that they keep under follow-up, they get the regular blood test done and the scanning done, because most of the liver cancers happen in them. So it's very imperative we find them early and treat it for a curative intent.
Thank you so much. That was such an insightful session. And we at Voice of Healthcare do really believe that discussing about health problems and building awareness so that people are more aware about their health, their diseases, and how to, take care of themselves is very important. So I would like to thank from the bottom of my heart to all the specialists present here today for taking out their valuable time and sharing such immense knowledge with us on liver health. Thank you so much. I would also like to thank Manipal Hospitals and all the viewers watching for staying with us till the very end. Thank you so much. Now, signing off, I would just like to say stay happy, stay healthy, stay prosperous. Thank you so much.
Thank you and have a nice day.
Thank you.
Thank you, everyone.